Scene script. Do you know how to properly care for your newborn's umbilical cord after delivery? The first few weeks of a newborn's life are filled with wonder and excitement, but they also come with many questions and concerns, especially when it comes to the care of the umbilical cord. The umbilical cord served as the lifeline between your baby and the placenta during pregnancy. After birth, a small stump remains, which requires careful attention until it naturally falls off. Here's how to ensure it stays healthy and free from infection. Firstly, keep it clean. You might think that the umbilical stump needs a thorough cleaning, but the truth is, nature does most of the work. The stump will dry up and fall off within 1 to 3 weeks after birth, and until then it's best to keep it clean and dry. Use a clean, soft cloth to gently wipe around the stump. If it becomes soiled with urine or stool, but avoid using soap or alcohol. These can irritate the baby's delicate skin and potentially delay the healing process. Secondly, keep it dry. This might sound challenging, especially when it comes to bathing your baby, but it's actually quite simple. Opt for sponge baths instead of submerging your baby in a tub of water. This helps to keep the stump dry and hastens the drying process. Another tip is to air it out. Fold down the front of your baby's diaper so that the stump is exposed to air. This not only helps to dry out the stump, but also reduces the risk of irritation from the diaper rubbing against it. Now you may wonder what to do when the stump falls off. It's a milestone in your baby's life, but it might also be a source of worry. Rest assured, it's a natural process and typically happens without any complications. However, you should be aware of some signs that might indicate an issue. If you notice redness, swelling, or discharge around the baby's belly button, or if the baby seems uncomfortable and cries when you touch the area, it's time to seek medical help. These could be signs of an umbilical cord infection which requires immediate attention. In rare cases, an umbilical hernia or granuloma might develop. An umbilical hernia is when a part of the intestine or fatty tissue pokes through the baby's belly button, causing a soft bulge. Most umbilical hernias close on their own by the time the baby turns 1, but if it doesn't, surgery might be required. An umbilical granuloma is a small piece of tissue that remains after the stump falls off. It might need to be treated with a special type of salt or, in some cases, removed surgically. In summary, caring for your baby's umbilical cord involves keeping it clean and dry, allowing it to air out, and being mindful of signs of infection or other issues. Remember, when in doubt, always consult with a healthcare professional. Navigating the first few weeks of parenthood may seem overwhelming, but with patience and care, you'll soon become a pro.